is a 59-year-old man who has history of sickle cell disease, and he presents to emergency department with fever and night sweats. He's lethargic and unable to give an adequate history. His wife says that 3 days ago he mentioned that something bit him, but he cannot remember what exactly. His blood pressure is low, his pulse rate is high, his respiratory rate is high. It means that he's quite unstable. He's lethargic and pale. His spleen is surgically absent. There are swollen bite marks on his right hand with red streaks extending to his elbow. Which of the following bite sores which will be most concerning for this patient? Cat bite, human bite, spider bite, fish bite, or a dog bite? So this is a patient who has sickle cell disease, whose spleen is surgically removed, and then he said that something he was bitten by something, but doesn't remember exactly. We don't know what exactly had what he was bit with exactly. Right now he has fever, night sweats, he is unstable, and he is lethargic and pale. You have to guess which of the following bite would have occurred. So this is a patient who does not have spleen. He has sickle cell disease and his spleen was surgically removed. Spleen is not there. So forever in your life, whenever there is no spleen, you always think of encapsulated infection. The first thing, and whenever there is no spleen and the question is about some kind of infection, the first thing that should come in your mind is an encapsulated bacteria. Okay, spleen is a major immunity point for removing encapsulated bacteria. If spleen is not there, there is a large chance of getting an infection from encapsulated bacteria. So this patient had some kind of bite, and after that bite, what has happened is that he has become very unstable after 3 days. His findings that I can see is it looks like he is having fever, night sweats, his blood pressure is low, so it looks like he's having sepsis. He has quite a lot of findings of sepsis, which is imaginable because we are assuming that he has been infected by some encapsulated bacteria, and if he does not have spleen, that encapsulated bacteria is surely going to lead to sepsis. They have written that there are some swollen bite marks and red streaks extending to his elbow. Which of the following source would be most concerning? So the answer to this is dog bite. The bacteria that they are trying to refer over here is some Capnocytophagia canimosus. So this, I think we should together try to kind of get this new information in our head. So this is a encapsulated bacteria. This Capnocytophagia canimorus. As a side note, this is quite common in microbiology that at least one question they will ask in exam about some weird bacteria. So this question actually leads me to a very good discussion point um, where I personally feel that microbiology is a subject that when you read, you feel like it is easy. I know the facts, I'll get through it. But somehow in exam, they will be, even if you go through all the exam paper, they will be asking at least one or two questions which are based on new facts. So it's the idea of ruling out stuff and all that might help you, but you might not even sometimes get the answer, and that's okay. One in question, getting one question wrong in 10 question is fine. Okay, so this is a encapsulated bacteria caused by dog bite, and it can cause dangerous infections like septicemia, blah blah blah, in this a splenic patient. They have written that cat bites can cause Pasteurella infection, which requires an empiric antibiotic treatment. Human bite was anyways not an option. I was confused between dog bite and cat bite. Seems like it's dog bite. There is not much implication of human bite for step 1. There is some kind of implication for it in step 2. Even for spider bite, it's not important for step 1. Fish bite might sometimes lead to some kind of mycobacterium infection, but it is not high yield as such. I think this question you should take it as kind of just remembering a new thing, that capnocytophagia can lead to a fulminant infection in patient without a spleen.
Thanks for watching. Please give a thumbs up and subscribe for more.